how do we use virtual service delivery to deliver a continuity of care so that the patient. So, are there any potential risks associated with virtual service delivery in healthcare, primarily telehealth and the like? The way I see it, there's two main risks here. Now, I'm going to take it from a clinical perspective. I'm sure there's like data security and all that kind of stuff. But from a clinical service delivery, patient experience, clinical outcome standpoint, the two main risks that I see delivering health services virtually are one, using the service, the platform, telehealth, to deliver the same, quote unquote, use it as a substitute or the same type of care that you would deliver in the clinic. And then two would be discounting the importance of human to human contact and sometimes in-person services. And it all kind of stems to the same root cause, which is understanding that virtual service delivery versus in-clinic delivery, it's not an either or, it's really a hybrid. Like, how do we use virtual service delivery to deliver a continuity of care so that the patient doesn't have one of those episodes of care where they come in, they see the clinician, they go about their way for 6 months, and then they come back. What's happening in that gap? Well, that's where virtual services can really come into play, is providing that continuity, making sure and ensuring that there's always access or a contact between the clinician and the patient. So instead of using virtual service delivery as, say, a substitute for coming into the clinic, yeah, you can't come into the clinic, let's do a telehealth service, which can help sometimes. Really looking at virtual services as a way to create a hybridized model of care so that not just are we doing the in-clinic work when you're coming in and getting an assessment and talking with the clinician, but then there's this entire back end, if you would, ensuring that the patient is staying compliant if it's a home thing, getting access to questions if through secure messaging or some similar function. Because what we're trying to do is not replace in-person care with virtual care. What we're trying to do is use all these tools in our toolbox to deliver a more full experience for the patient, and one that involves more touch points and more access to improve clinical outcomes in the long term.